menstrual cups as opposed to tampons. I guess that a lot more women are using these. The question is, are they a safe alternative? My first thought looking at this is, number one, are they appropriate? And number two, how does it really truly work? I know how it's supposed to work, but does it?
Yeah, people like menstrual cups. They do. People like menstrual cups.
Especially millennials, for whatever reason, they think it's better for the environment, that maybe they think it's safer in terms of toxic shock.
It probably is better for the environment, right?
Yeah, better for the
reusable.
environment. Right, so you basically just put the cup into your vagina and then it catches the blood and then you remove it. So
and as long as you do it appropriately, it does a good job.
Well, that's the point of this study. So people will associate tampons with toxic shock syndrome, which is a rare but potentially life-threatening condition that can occur due to certain types of bacteria. So they're saying, well, we're going to use these menstrual cups to decrease the probability of toxic shock syndrome, and we're going to use them because they're good for the environment. Well, the problem is there was a study that suggested these menstrual cups could actually be more dangerous when it came to toxic shock syndrome. So they said when you insert it, there's air that comes in with it, and because of that air, it can help the bacteria grow. So it's a staph bacteria that's associated with the toxic shock syndrome that likes to grow in the midst of air. And because of that, the incidence of toxic shock syndrome might be higher. Additionally, according to the labels, when you take it out, you're just supposed to rinse it and then you can reuse it. Well, they did a study where they swabbed the cup, and when they checked it again 8 hours later, they found that staph was still on the cup. So that's that bacteria you don't want for toxic shock syndrome. If you're going to use this, I would recommend getting at least 2 so you can alternate, and when you take one out, you can boil it instead of just rinsing it. Also, make sure you have the right size. You don't want it to be too big, and if you happen to see symptoms of toxic shock syndrome, like a really high fever, or you're feeling dizzy because your blood pressure is really low, or sunburn, like rashes on your palms or soles, make sure you see a doctor. But I think the moral of the story is, don't think you can't get toxic shock syndrome because you're not using a tampon, because there are other reasons for toxic shock syndrome, like cuts or bruises after a surgery, and you can still get it with a menstrual cup. It is rare,
Fortunately, very, very rare.
It is rare.
With these menstrual cups, would you go into your OB-GYN to learn how, I mean, does that kind of wrap around the edge of the cervix? So
you can buy these just at the store, and they'll ask you if you've had a baby and kind of things like that, and then you just kind of put it in. But they're comfortable and they're not bad. I'm not saying you can't use it, but I'm just saying be educated and realize this isn't the solution if you're saying, I don't want toxic shock syndrome. I know some people aren't familiar with the menstrual cup. Some people love it. The blood really will stay in there well. It is a bit of a learning curve when you're trying to learn to take it out. When you learn to take it out, because you don't want it to spill everywhere, obviously. But like I said, people love it, and they work. They work.
Teach their own. Talk to your gynecologist.